Right, and some breaking news that's just come in. This is coming in from the southern state of Tamil Nadu in India, where one more case of a novel coronavirus infection has been reported. This will be the 35th confirmed case of a coronavirus infection, and this has been confirmed based on a test that was conducted at the King's Institute, Chennai. And later the sample was also tested positive at the National Institute of Virology based in Pune. The Tamil Nadu's Health Secretary, Bila Rajesh, has informed that a person has been identified as having tested positive for the coronavirus infection. It is presently at a hospital, and they are also tracing the contact history of this individual. The screening of every person coming in from outside continues. Now, for more on this, we are joined in by our correspondent, Siddharth MP, who is joining us over the phone line from Chennai. Good afternoon to you, Siddharth. What more information do we have about this case of a novel coronavirus infection that has been reported in Chennai?
Indian Health Secretary Bila Rajesh, we've been told that this case was actually from a patient who had had a travel history from Muscat. So it was from 20th Feb that he came down to Chennai from Muscat.
நீங்கள் பேசிக்கொண்டிருக்கும் நபர் உங்களுடைய அழைப்பை.
All right, there seems to be a bit of an issue in terms of connecting with my colleague Siddharth there. We'll try get him back online with us again. But this is the latest bit of information where this individual reportedly had, just as my colleague was explaining, returned from Muscat on the 20th of February. Now, today, of course, is the 8th of March. Now, it remains to be seen, was this person exhibiting symptoms at the time when he was at the airport while he was returning, or did the symptoms subsequently develop? All of these are details that will have to be found. But I'm told that my colleague Siddharth is now back on with us. Siddharth, so tell us, what more do we know?
So we know that the patient had a travel history from Muscat and had come down to Chennai on the 20th of February. And at that point in time, he was totally asymptomatic. And then it was on the 4th of March that this individual came to the hospital with a case of fever. So it took a couple of days, at least a handful of days, for the person to know that he had fever and then go to the hospital. So from asymptomatic to having noticed his fever, it took about 5 days. And then it was only on March 4th of March that he had gone to the hospital with fever. And so far, the health secretary has told that 54 samples have been sent and all of them are negative, and there's only one positive sample that has been confirmed by both the King's Institute and the National Institute of Virology, Pune. And we're also given to understand the virus has an incubation period of 14 days, which is why the patient initially did not have any symptoms pertaining to the virus when he first landed at the airport in Chennai and then later went to his home. And also the other contacts of the patient are being kept under surveillance, and all his tertiary contacts are also under surveillance, and they're trying to find out who are the people he came into close contact with, where and all he traveled locally. And we're also given to understand that the government is trying to ensure that there is more masks that are made available in the market given the current shortage.
All right.
And also for other public events that are going to happen, like the upcoming IPL, they are planning to take precautions to ensure that all is well and everything can go on. And they'll be analyzing the situation, monitoring it very closely to ensure that public life is not disrupted. At the same time, that, adequate precautions are taken to minimize the risk of infection. Absolutely,
indeed. And also, at this point of time, we're given to understand that the patient has been admitted to a hospital where he is under medical surveillance. What do we know about his family members that he would have been in close touch with? And also at his workplace, has anyone else been tested for the coronavirus infection, and do we know about the results?
So the government has not revealed anything with regards to the particulars of that patient except for his gender, and this is primarily because they did not want the public to, get into rumor mongering or fall for any misinformation that might do the rounds after specific details regarding his workplace or his whereabouts, or even the patient's family and their residential location are revealed. There is always a chance that more misinformation can be circulated. So they've kept that information very secret and closely guarded. So all that we know is that one patient is affected and that they are doing all that they can to ensure that, this patient is given the necessary care at the Rajiv Gandhi Government Hospital in Chennai.
All right, doing all that they can. That is what the government says that it is doing. Thank you very much indeed, Siddharth, for joining us and getting us all those updates. So this is the 35th confirmed case of a novel coronavirus infection that's been reported in India. There are 5 more suspected cases, although the Kerala government has confirmed them. The government at the centre is yet to confirm these 5 suspected cases within Kerala.